Welcome to tonight's webinar, an expert session on tele-optometry featuring Stacy Sidwell, who's a board-certified optician in Florida, as well as NCLAC certified. Also featuring Dr. Noel Chang, who's the Director of Professional Services for 2020 Now, and also one of our clinical providers. The first thing I'd like to do is actually share a little bit of overview of how we do a tele-optometry exam in an office. A lot of people may think of tele-optometry as something you can do at home on a phone, but that's not the type of tele-optometry that we're providing. What we do is an in-office comprehensive exam where the patient is on site in an office and an on-site technician is actually doing the normal pre-testing that they would do in any other doctor's office. So in an optical retail setting, the on-site technician or optician is actually trained by us to perform the pre-testing and then remains with the patient through the remainder of the exam. So typical pre-testing includes an autorefractor as well as retinal imaging on a retinal camera that takes a nice view of the back of the eye, as well as some form of non-contact tonometry, whether it's an air puff device like the common CT80 here, or a handheld eye care device is another very common non-contact tonometry test. The patient is then seated in the exam chair, and a digital slit lamp is used in order to capture images for angles of the eye for glaucoma, or the back of the eye for cataract assessment as well as the lens. And then a refraction is performed on a digital phoropter. A technician who's all COT or COMT certified comes on the screen, controls the digital phoropter remotely, performs the subjective refraction, and then a doctor comes on the screen in order to finalize the clinical results, review some of the images with the patient, finalize their prescription, and then the patient receives their prescription within a couple minutes of the exam being completed, so they can go out into the optical and complete their optical purchase on the same day. So that's a little bit of an overview on the optometry comprehensive exam that's done in an office setting with 2020 Now. With that, I'm going to turn it over to Dr. Chang, who can kind of pick it up from the point of a refraction. What's going on when the remote technician comes on the screen to control the digital phoropter remotely. And then from there, we'll touch base with Stacy to see what her experience has been as well. Thank you so much. And if you have any questions, drop them in the chat and we'll start from there. Dr. Chang?
At that point, then it's going to normally go into our refracting queue. And we have a fantastic system that our IT team has built where sites are able to add the patients to our queue when they initially come in so that we can kind of prepare and know that the patient is there at your location. And then as soon as they're ready for refraction, our refracting team, which is consisting of a certified ophthalmic technician and a remote refracting optometrist, they're going to zoom in and they are going to be able to remotely control the refraction. So the patient's behind the phoropter, just like in a standard comprehensive exam, if the doctor's there on site. Many of you are probably familiar with the ones that can be kind of remotely controlled. This is just taking it a step farther, and we can control it remotely from our homes or from wherever we're working. So then once the data is kind of gathered with the refraction, then it's going to get passed off to the licensed doctor who's going to have been reviewing that chart in real time to look at all the imaging, to look at all the ancillary testing, and then to review the data regarding the refraction and their vision to ultimately make that decision as to what the subjective refraction will be. Now, Stacy is one of my favorite people to work with. She's amazing with the trial frame. There's many times where I'll say, hey, there's been a big shift in the prescription. Like, can we go ahead and trial frame? So it's always the doctors kind of guiding the request there in terms of what the prescription is going to be finalized as. So then the doctor is going to call in and synchronously talk with the patient. Those interactions, are two ways. So the patient can see us, they can hear us, and we're able to answer any questions they have. We always review their refraction findings, answer any questions. We normally get to show them pictures of either, if they have a cataract or any retinal findings. We always try and show them at least one image. And it's pretty fun because the patients, we're showing the retinal photos of the back of their eye. Is that Mars? Is that an orange? Like, you get some pretty neat answers. So I hope that gives kind of a good general rundown for everyone. And the prescriptions, of course, are getting signed off. Referrals are getting written when or if necessary. At that point, I'll kind of pass it over to you, Stacy.
Great. Thanks so much, Dr. Chang. Stacy, you want to share a little bit about why you brought teleoptometry into your practice and your experience since you've had it since you're one of our longest standing customers.
Sure, thank you. Thank you for having me. When I opened up, I started out as just independent optical, very small, and I was waiting for outside prescriptions to come in. And I was averaging anywhere per week 5 to 10 patients. I knew I had to do something to capture more walk-ins and generate more business. And so that's when I chose to go with 2020 Now. And now I see about that many patients per day. And it's been a great result for me.
That's great. So, Stacy, you've had obviously a lot of questions from a lot of customers over the years that call you and ask you different questions. Just kind of high level, do you want to hit on kind of some of the most common questions first? I'm going to ask, everyone can ask questions in the chat. So feel free to ask questions. We did get some couple questions that were pre-asked. They emailed in before the meeting. So feel free to, enter some questions in the chat, and we will just kind of go through them one by one. And so, Stacy, if you just want to share kind of, what are some of the most common questions that customers call up and ask you about bring this into their practice and kind of what your experience is, and in that way, that'll probably alleviate some of the most common ones, and then we'll kind of get into some more specifics.
Sure. One of the things that we do is we ask the patient, do they know about our location? The biggest disconnect is how can you do an eye exam when the doctor is not in the office with you? So what we do is I have an assistant and we explain to them that we are an in-office teleoptometry visit and that you will be in the office throughout the entire visit, and part of it will be remote when you speak with the doctor and the technician. And since I'm a licensed optician, I actually let them know that I'll be with them throughout the whole from start to finish, even with styling the glasses. I think that's the biggest question is how do you do the eye exam without the doctor in the office? We also offer free tours of our office when patients are unsure of it or they have questions about it. So we let them know that they're welcome to come in and we will walk them through. My location is set up with the pre-test in one room and the exam lane with another. So we offer those. And I also do open houses just to get people familiar with the setup.
That's great. Some people have raised their hand to ask a question. You can enter them in the chat. We're getting a couple in already, but I do want to be respectful to the people that pre-submitted questions. So we can start with the other question was about our remote technicians. Are the certification for remote technicians are all COT or COMT with JCAPO certification. Now, and Stacy performs your own exams, or you may have some other staff. I'm going to ask you to unmute. You can come on. So a lot of people ask, can an optician do this? Can an optician owner of an optical retail store do this without a doctor on site? So in most states, and we can talk about legalities in certain states, but in most states, we can train a person to do these exams in their offices. So Stacy, you just want to share a little bit in terms of your experience as a, kind of the training, because that was another question we received. Do you want to share a little bit about the training that you received and your comfort level in being able to do the exams before we showed up and after we showed up?
Sure, of course. I came into it with a cross-trained background. I knew how to do most of the entry-level equipment, pre-testing, autotonometer. I did have to get more training on the retinal imaging. So I had on-site training for 5 days, and 3 of it was with a technician one-on-one that was provided by 2020 Now. And at the 3rd day, I was able to start scheduling exams while the trainer was still here. So she was with me step by step. And she made sure I was familiar with everything. If you're not familiar with the slit lamp, which I also did have experience with that, I just added more training to become more familiar with taking the images and everything. It becomes muscle memory. And I actually created a step-by-step list when I first started that she approved so that I could become familiar with each step. And now it's just clicking in muscle memory with taking everything. So I had 5 days of in-office training, and you still have open training as needed if things arise.
Yeah, that's great. Thank you for sharing your experience. Yeah, I think some people feel that maybe they're concerned they're going to be able to do this in advance, but we do have a really great turnkey solution. I don't like to oversell it, but I think by the time we're leaving, you're doing live exams on patients on the 4th and 5th day of that 5-day training. So we've got a lot of questions coming on in the chat. I want to start going through them. We answered all the pre-submitted questions, and so appreciate that. Feel free to keep asking questions in the chat. I mean, I'm here all night. Stacy and Dr. Cheng are probably only here for the hour, but I'm happy to keep answering questions. So we're going to go in, and first question will actually be for me. Do you have a preferred list of equipment you require for the remote exam? It's a great question. We integrate with 18 different OEMs. I know that we're joined here tonight by some industry partners. And so our strategic alliance with Visionics, we integrate with all their technology. And but if you already do own equipment from other vendors, certainly we can integrate them based off of make and model numbers. If you get us make and model numbers, we can determine whether or not that's something we can integrate with. We are primarily a software company, actually. So a combination of the professional services and the software. I'm sure Stacy can attest to the IT support she gets whenever she has an issue. Basically, our three lead software engineers write all of our proprietary software technology that allows us to do our exams, whether it's the routing of the exams to the doctors through our workflow software, or just the intellectual property that we've built out with integrating with different 18 OEMs. And if somebody has a new make and model, we typically will integrate with that. So like I showed in the beginning of this with the 3D tutorial, the 3D view, you can see we just did integrations with Visionics' latest multi-testing platform, the VX650, their new short chart system. And so we're constantly innovating and adding more to the list. But the first step would be getting us a list of the equipment that you do have in an office. And then we could tell you what you would need in addition to our software. We'll make you a price build and we'll handle it that way. So, basically each office is pretty unique in terms of the equipment, but that's kind of where we go with equipment builds for each individual patient, each individual office. Next question comes in from Heidi. It's, if a patient needs myopia management, will they have to be referred out, or is this something that 2020 Now can handle? I'll turn that over to Dr. Cheng.
Excellent question. Yeah, so as many of you know, the MiSight contact lenses for myopia control are FDA approved. That is one that we do offer as an option. We do not do atropine drops. We do not do ortho-K. We are also able to do the off-label use of biofinity multifocal contact lenses that was studied in the Blink study and shown to be clinically effective for kids, with myopia control. So both of those, I think, are fantastic options. They tend to be much more beneficial to the patient in terms of comfort. The atropine drops are a good option for myopia control, but patients tend to honestly not like it because it causes so much photophobia or sensitivity to light. And the MiSight contact lenses, most kids are excited to get in contact lenses. They'd rather not be wearing glasses. And so being fit for that, I think is a great option, especially because myopia control is the new standard of care. So that's definitely an option that we are able to offer. Yep.
Great. Next question comes in from Laura. We are just opticians in California. How much equipment do we need, and is this legal in California? So it's a really great question because it brings up the nuances of each state. And so we do have customers that operate in California that are optical retailer only. They're non-doctor owned entities. We actually have to sublease that space in California. In California, a non-doctor owned entity cannot accept an exam fee through their bank account, essentially. That would be practicing optometry without a license in California. Some states, in other states, opticians can hire doctors and can bill for exams under their tax ID. So every state's a little bit different for that type of nuanced question asking. We'll just ask you to reach out to us and schedule time to speak through our book a demo on our website, and we'll have a conversation about your states. But to answer the question specifically, California, Texas, and Virginia require a sublease business model where we sublease the space, we bill the patients directly, we provide a credit card terminal on site that you can collect the patient copay for or a self-pay fee, and we will bill like VSP out of network or do self-pay, depending again on the different businesses in different states. In other states where an optician-owned business can contract to be a full-service exam provider, they can add our doctors to their plans, credential the doctors, and bill for that under their tax ID and collect the fee. So again, every state just a little bit different in terms of how you can practice, optometry and or bill for eye exams. So great question, Dr. Chen.
I would add to that if possible, Bob, is in California, optometrists are the ones refracting patients. That's a state requirement. So, we'd mentioned certified ophthalmic technicians are the ones doing or collecting the data in most cases, but in California, the doctor is collecting the data, doing the refraction, and making the final clinical decision.
Yeah, it's a great nuance there. In California, about 2 years ago, a bill was added in which it said essentially physicians, optometrists and physicians, which we are an ophthalmology PC. So that also gives us a lot more legal flexibility in how we can operate, even though Dr. Cheng, for example, is an OD, but working for an ophthalmology PC is able to be delegated certain medical abilities, working for an ophthalmology PC that perhaps an OD-owned entity is not able to do in certain states. Again, varies by states. So in California, when that law was passed, it did apply also to physician-owned businesses. A kind of a funny unintended consequence, I think, of that law is that actually made our exam process faster in California because there was no need to wait for both a technician and a doctor. A doctor does the refraction and then is also immediately, on the call to complete the rest of the clinical exam. So that was a good byproduct of that rule, actually, even though it's a little bit more expensive for us to do that, having doctor perform the refractions. But it all worked out in California for our customers. So hopefully that answers that question. And yes, it is legal. The equipment we already addressed. It's a standard pretest lane and a digital slit lamp, digital phoropter. So if you miss that, we can always again do a review of the equipment for you. Next question from Greg is, do you accept any insurance? If so, how do you bill for the exams? So we already kind of answered that part of it a little bit. It's nuanced. Some states you add us to plans and you bill for it under your tax ID. In other states, we will just bill, VSP out of network or self-pay. The challenge comes in that in states where opticians typically cannot contract to be full service exam and material, insurance companies may add them to only a couple of plans for the material side. And they may add us to only a couple of plans for the exam service side, because in the past we actually did this for clients. But those plans actually wouldn't even match because the insurance company may have dozens of different plans. And so it just wasn't a good experience overall. Really, the best way to do it is to, in states where you are able to contract and be a full service exam and material provider, that you can do that, add our doctors to those plans. The plans match because they're all underneath your tax ID. So again, a conversation needs to be had based off of different states around the country. So really great question there. And how long does a typical routine exam take with this setup? What I say on our website is 30 minutes or less. Jokingly, I say it's 30 minutes or more, depending on whether or not you're doing contact lens exams. But ideally, the pre-test is around 10 to 15 minutes, depending on the technician. And then the wait time nationally for a technician to do the refraction is 2 to 3 minutes, and also 2 to 3 minutes for a doctor. So that's on average. Sometimes it can be a little bit more. Sometimes it's a lot less. I would ask Stacy if you can share your individual experience. I know you do a lot of contact lens exams and actually fit them yourself, if I recall correctly, because you're
Correct.
NCLEC. But do you want to share just your experience on like what is your your average exam time? And I could pull up a report and show it to you. But if you kind of know off that we track everything, every click, and so we know how long it takes. It's the whole patient experience. But do you want to just share your personal experience on what it feels like on your side?
Sure. I also prepare the patient for their time in the office, and I've shaved time off from when I first started to now. And what we do is, I would say it's 30 minutes less, more than 30 minutes more. And I block an hour. Now, this is not for just the exam. This is the consulting, styling, and everything. So I would say 30 minutes with pre-test check-in, seeing the technician, refraction, and doctor. I trial frame every patient as well, even if the doctor doesn't, request me to, just to confirm the prescription while the patient, and they like that interaction one-on-one with me as well at the end. And then for contact lenses, I do an hour and 15 minutes because once the doctor releases prescription with their approval, I continue on site with fitting and assessment of contact lenses.
That's great. Thank you so much for sharing your experience. Yeah, I mean, I would say on average, we live and die in these reports. We look at this from a service level. This whole service comes down to the amount of time you're sitting in the wait room, in the exam room, waiting for a technician or doctor to come on the screen. Those 2 to 3 minutes can seem like a long time, right? So we know that that's the whole patient experience, really. And so, we keep a very close eye on that and track that nationally. The last report I just did nationally was like 2 minutes nationally for wait time for a technician and 3 minutes for a doctor. So that's right in our wheelhouse. But we can look at that by state, by account, and so we can keep very close eye on that for everyone. The next question comes in from Sage. Is this legal in all 50 states? No. Like we already addressed, there's some states where it's not. So just off the top of my head, you have certain legal restrictions. So it can be a combination of both optometry board regulations, medical board regulations, or house state laws. So you have 50 different sets of those for each state. We have one of the leading global healthcare law firms in the world that keep track of this for us, and I get weekly updates. But you have some restrictive language in laws that specifically would prohibit us from being able to do this in like South Carolina, Nevada, Oregon, I
New
believe
Mexico.
Kansas, New Mexico, right? And Dr. Chang, any ones besides those 5 or 6 that I just mentioned that you can think of off the top of your
There's
head?
some states that are restricted more so with optometry than ophthalmology.
Right.
So yeah, those are the ones I can think of as
Yeah,
well.
those
But
are the main ones. There's also some restrictive language in terms of on contact lens sides, it can get even more restrictive by state. No first-time wearers, only if they had an exam 2 years prior. So that's again something that we would speak very individualized about in your particular state. But if you are in one of the states that I mentioned, Nevada, Oregon, New Mexico, Kansas, South Carolina, it's really quite restrictive in terms of language. For example, essentially, you can't do even an auto refraction without a doctor on site. So when the laws read like that, that a non doctor cannot even do data gathering on a pre-testing device, then that's a state that we would not provide those services in. So hopefully that answers that question. The next question is a great question about young patients. I know you addressed one of the hard stop questions, but can you use this system for kids? What's the small size exam room this works in? I'll answer the second part, but my understanding right now is we're doing it down to 8 years of age in each state. Is that correct, Dr. Chang? Oh, sorry, you muted yourself again. I'll ask to unmute if you. Is there anything to add to that?
that is correct.
Okay.
Yep, 8 years and older is the current stipulation we have for all states. Correct.
Stacy, I don't know the age demographic that you necessarily go down to in your group. Do you have any experience doing this with like children under 10 years of age that you could share?
Yes, we've started at 8. When we first got approved, it was 10 years of age, and then we started promoting 8 years of age. I use the All Eyes virtual field or visual field. I do find that manual confrontations do better with the younger children, but there's been no obstacles with doing that. So I have expanded my patient base since the age drop, is allowed to be 8 years and young, starting at 8 years and old.
Great. Yeah, appreciate your experience there. Next question about Puerto Rico. So again, very specific situation. We've had a number of clients reach out to us about Puerto Rico. We're not currently operating there, but would be open to discussing the possibility of doing it there. And so it's something that I feel that we could do if a customer was interested in pursuing it with us. So sometimes it's very much a partnership in getting a new location launched for us. Next question would be, how are dilated exams handled? So this is a non-dilated exam. Dr. Chang, I'll turn it over to you, but I know in some instances, if there is a doctor-owned entity and a doctor was on site, could they do a dilated exam if a doctor was on site? Is there any reason we wouldn't do that? Because I know some insurances like Medicare requires that. And I was just curious if you could share any light on, is there any reason we could not do a dilated exam if a doctor was present?
Yeah, so currently, if you're contracting with us for the telehealth services in terms of having a provider call in, then dilation would not be offered because we are not, as the doctor, there on site, and we're zooming in online. So, in the best interest of the patient, in case they were to, on a rare occasion, have anaphylactic reaction, that's not That's not possible due to state regulations and compliance issues. Now, if you're utilizing our technology and you wanted to use our EMR, you wanted to have our team refract, and then the doctor there on site is still coming in and reviewing with the patient, then that absolutely would be a situation where it is possible to do dilation.
So for a doctor-owned group, if the owner of the doctor-owned group was actually signing off on the exam, they could do a dilation as they chose to using our technology platform. But we do not have our doctors sign off on dilated exams due to a medical legal liability.
Exactly.
Okay, perfect. Okay, so going back to the answer on myopia control, who would be teaching contact lens INR if 2020 now is not an optical? I assume at Stacy's office, she would teach INR. And so that's totally correct. But I'll turn it over to Stacy and Dr. Cheng if you have any insight. Stacy, in your office, do you have anyone do exams besides you, or is it just you doing it?
So it's just myself. And to answer that question, with every patient that one of the doctors from 2020 now sees, when I screen the patient, I ask them if they are going to be doing contact lenses, and I notate that in the EHR communicating to the doctor that will be doing the remote exam. So that approval is upon their discretion based on the ocular health of the eye. And then once that is done, the prescription is released to me. If the patient needs an INR, I am a board certified optician, so I'm able to fit and adapt and assess on site with the doctor's release of the prescription. And I do soft contact lenses, no RGPs, and I do no extended wear. So it is limited, but I am able to, and I do the INR if needed. So it would be myself or my assistant who's also trained to do it under my license.
Dr. Cheng, any other experience from any of our other practice types that you could add to, or?
Yeah, the one thing I would add, Stacy being NCLE certified is fantastic and works really well. But we work with multiple locations where, it's licensed dispensing opticians or various different team members. So we do have a training process where if a site is interested in getting certified in INR insertion so that they are able to do first-time contact lens fittings, then our training team and legal team is working together to make sure that it's a viable option at that location.
Yeah, that's great. Yeah, so in offices where an optician cannot fit contact lenses themselves, we can do the fitting for both new fits, refits, and renewals. Again, depending on specific state guidelines for contact lens rules. So some states it could be a renewal only, or a refit only if they were there 2 years prior. So there's just some different nuances to work through, but we could certainly work with everyone individually to answer those questions. Another question, I guess, for me on can this work with the Smart Vision Lab equipment? I'd have to know more specifics about exactly what they had. Some things that are proprietary to us is the computer system, the software platform. So we have a one-time setup fee. If you already had everything you needed to get set up and running with our system, we would go in and install and train for 5 days, as well as our software platform, and provide the telecommunications package and the computer equipment and network everything. And that would be around $20,000, just to give you a ballpark number. That's if you already had every diagnostic device you needed. If you needed every diagnostic device, I have this on our website. I believe I have around $85,000 on average. A brand new build out with this, best equipment could be around $95,000. On average, it's around $85,000 because you already have a lensometer. Maybe it's just a manual lensometer, but that's what a lot of opticians prefer. Maybe you already have something else like an autorefractor or an exam chair. So, on average, most offices probably need around $65,000 total because they have some things. And that's where we do a very customized build for you. So I would just need to know make and model numbers of any of the equipment that you already have on site. And that's what would determine whether or not we could use it. So I know that I have switched over some customers who maybe were previously franchised with other groups. And in that instance, they had a digital phoropter that would work. They had a digital slit lamp that would work. They had a retinal camera, autorefractor. So their cost to switch over was very negligible. It was basically just our one-time setup fees for around $20,000 in total. So, and that includes the 5 days of training. It's really everything to get you up and running. Happy to do a custom quote for anybody, and then we can just take it from there. Next question would be, what does this service cost for a typical 5-day-a-week 30-minute exam schedule. So what we're currently doing is we charge again, in the states where we can do this business model. So except from California, Texas, and Virginia, where it's a sublease business model where we charge the patient directly. Under our telehealth contract business model, we charge $50 per exam, and we have a $2,000 monthly minimum that begins after the third month. So for the first 3 months, there's no minimum. And after the third month, it's a $2,000 monthly minimum, which comes out to about 40 exams per month. I tell people that generally speaking, I think if you could do 1 exam a day, 20 exams a month, that's a good starting point for bringing this service in, where depending on what your average optical sale is, you're profitable. And I guess, I would ask Stacy, do you want to, share whatever you're willing to share in terms of kind of your practice profitability with what you're currently doing? If you want to share a little bit of the numbers, I'll preface by saying, let's say you didn't have any equipment and you need to purchase everything you needed and you're financing around a $2,000 package on the equipment. And then you're 3 months down the road and you're paying the $2,000 monthly service minimum for our service, but you're only doing, let's say, 20 exams, and let's say you're charging $100 per exam, you're collecting enough money from the exam fees to pay for the service minimum. And that's why I use that $20 number as kind of the entry starting point. If you're doing insurance exams, you're collecting a lower average exam fee, but you're doing a lot higher volume of exams. But the end goal of all this is increasing optical sales. So with that, I'll kind of turn that over to Stacy, where if you could at least do 20 or 30 a month, you're already profitable if you're doing like 1 exam a day. But Stacy, you want to share your experience there?
Well, that's exactly how I based my numbers with the exams, is to look at it if it's getting the patients to come through the door and be able to provide the full service. I average anywhere from, I think it's 40 and up on exams, and I look at that cost and that revenue to take care of my cost of doing business for the service. And then when they come in, it's the opportunity for me to offer them the optical and provide the services on that side of things.
That's great. And I know there's going to be some additional questions for Stacy, I see in the chat, but Patricia has a great question out of Mississippi. As an optician, I can't have a doctor without a separate entrance. How does that work? And so this is really great point here because, like, for example, in Texas is also a hard two-door state in which you need a physical separate entrance for an optometrist to practice on site. But as I mentioned before, we're an ophthalmology PC. And actually, specifically in Texas, the AG, Attorney General, actually ruled on this and said that, essentially paraphrasing here, that the optometry board regs do not apply to the optometrist when they're delegated authority via medical board from an MDPC. So kind of paraphrasing that, and always advise everybody to speak with your own legal counsel in any state. You should never take legal advice from a salesperson who works for a company. That's kind of my running joke there. Like, don't do that. We've seen people get jammed up in certain situations with other business models, and then have come to us because we're an ophthalmology PC and we were able to help them get it done correctly in their particular state. So to answer the short question, Dr. Cheng, I believe we're providing services in Mississippi. I would have to go back and check it. I'll unmute you.
Thank you. Sorry. Yeah, so in Mississippi, optometry is actually unfortunately not allowed for telehealth currently, but ophthalmology is. So we do have providers who are ophthalmologists that are actively seeing patients in Mississippi.
In Mississippi, great. Okay. Oh, so we're actually doing something a little bit different there, where we're not even having our optometrists see the patients in Mississippi. We're having some of our ophthalmology providers see the patients in Mississippi. Got it. So yeah, to let everyone know, we actually have, not just optometrists on our panels, but we also have some ophthalmologists, both MDs and DOs on our medical panel. And again, it can vary by state, and we have to talk about that individually. But hopefully that answers your question, Patricia. So it could potentially work in Mississippi because we do have, we just have to speak more about, like, I'm not sure what our total coverage availability is because we don't have as many providers of the medical side. So we might have to ramp that up for if we get a lot of additional customers in that state. But I think as of right now, we don't have an issue in Mississippi in terms of being able to provide coverage for the next first person that wants to come on. So I'll leave that to you, Patricia. Answering a question from Caitlin Jones. Stacy, are you the provider signing off on the contact lens RX, or if it is prescribed a 2020 now exam provider? And before you answer that, I'll just say there's two different ways that we can do that. Number one, on our medical side, Dr. Cheng, right? When we're doing the contact lens fitting, our doctors are signing off on the contact lens RX, correct, Dr. Cheng?
Correct, which is
Okay.
how it works at most locations because we don't work with as many NCLE certified opticians. We love to, but there's just not as many out.
Not as many. Now, my understanding, and Stacy, correct me if I'm wrong on this, is that in a NCLEC situation, you can actually sell the patient a contact lens that you fit them in, but you're not actually, I don't know if it's different in Florida, but in some states, the opticians are not able to actually write a prescription for that contact lens fitting. It's just they're able to take an outside RX and actually give them the contact lens fitting. I don't know if I'm off base there, Dr. Chang or Stacy, if either one of you have advice on that for anyone.
So the NCLE certification is the National Contact Lens Exam, which allows you to do that and do certain things under a prescribing doctor's license. I have a step above that with the board certification that is carried with my state optician's license, which allows me to do the fit assessment and the writing of the prescription within the Florida guidelines.
Gotcha. Okay. Yeah, I mean, and I know there's just a lot of variability between different states, so I don't like to
It does
overstate what
depend.
people. Okay. So maybe more specifically, Caitlin, we could talk about the state that you're in, and we could research that for you and see possibly how it would work for you in your particular state. But generally speaking, if you're NCLEC, you can fit an outside spectacle RX. Our spectacle RX would essentially be that outside RX that you could then fit contact lenses off of. Next question from Megan. Any new information on getting 2020 Now set up with iMed? It's a great point on for sublease locations where we have to contract with plans. What we are currently working on, and I still do not have a completed process on this, but we are actively working on it. It's at the lawyers. A lot of opticians that are in states where they have never had they cannot hire a doctor and they've never had a doctor on site before. They are not full service exam and material providers. And so they have a challenge in which they cannot actually get contracted with a plan because they need a doctor to sign on the bottom of that contract. And so again, on some plans, not all the plans are the same. Some of the plans require that. And so what we're working on, what Megan's asking about is a program in which we're working on a program in which we're actually going to be able to give one of our doctors to you to actually establish your full service exam and material contract. And then from there, you can add our additional doctors to your plans and credential them. It is a bottleneck, we know, with a lot of optical retailers right now who have never had a doctor on site to establish those. It is still in legal because there is various medical legal things to be done. If one of our doctors is signing a contract for, an optical retailer and, we need to indemnify them from potential billing fraud and things like that. So we do need to button it up medically, legally before we roll out that program. And my CEO is actively working on that. Okay. Next question for Dr. Chang. What about prisms? You want to answer that one?
Absolutely. Yeah, this is a fantastic question. So if the patient is coming in with new onset double vision, then of course that falls under a hard stop and we would further investigate that. If the patient currently has prism in their glasses and they are seeing well, no diplopia, they have no concerns, then we can check the prescription and renew the prism amount if they have a physical or digital copy of the prescription. However, if they do not come in with the physical or digital copy of the prescription, or they're having, double vision that is new, then we are not able to do prism.
Another question comes in here is, are there software update fees? So the good news is there are not any software update fees. Part of our process is, we're completing the exam. So our business model is we're there to help you do more exams. When you have technological issues, Sometimes equipment goes down, things like that happen. I think that we're very responsive to our customers. We're not just selling you some equipment and disappearing because our business model is the exam. So it's truly very much a partnership. I would ask Stacy. Stacy, I know from time to time you had bought like a pre-owned camera, previously, and then you had an issue with that. And I think we worked with your vendors to try to resolve it. But you want to share just kind of real quickly about your experience, I guess, from a customer service standpoint. Before that, I'll just let you know, like all of our software is sold as a one-time licensing package in that one-time setup fee that I discussed previously. And then part of the exam fee on our contract, we actually break it out. Part of it's a clinical fee for our clinical professional corporation, and part of it's a software fee for our LLC business. So we have two basic business entities. And that's broken out on a contract, but it's that $50 per exam that I talked to you about. We just separated it on the backside for our business purposes. And that's what basically is used for like the software fees essentially. So there's no separate line items, there's no separate fees or updates or there's plenty of updates, but no update fees. So we're constantly iterating the software. We just rolled out a brand new EMR that we built from scratch ourselves. And when I say we, I mean one of our very talented software engineers redid our entire EMR from scratch. Can you share a little bit about your customer service experience?
Sure. I'm very happy with the customer service. I mean, even from a daily interaction, IT is always readily available within 2 minutes if something glitches or something is not working as it should. The team is very responsive. From an equipment standpoint, I've had the same experience. I reach out to IT. I've worked directly with you. I had a piece of equipment go down. It wasn't repairable in the office. You assisted me with getting a loaner, and then I was back up and running. My 4-opter was stuck, and I got a loaner. I was able to help with IT install it myself. So it's definitely hands-on and continued customer service.
That's great. Yeah, thanks for sharing that experience. The question was, Stacy, do you accept insurance? One of the number one questions I also always get asked is the VSP question. How do you handle that? Do you want to answer those two questions?
Absolutely. I do take some insurances. The area that I'm in, I was very familiar with. I did a lot of research as far as which insurances I did want to take. I'm in a community, but located across the river from Kennedy Space Center. So I knew that there was going to be, contractors, subcontractors with insurance. The school board is big here, and county. So I take several of them. For the ones that I cannot take because I'm optician owned, which is VSP, which is one of the biggest questions. I use Anagram. I've used Anagram since I started, and I have a really good capture rate. And I have some statistics, Bob, if it's okay that I share it.
Of course.
So yeah, I got some data recently, and I started June of 2020, which was even prior to me starting with 2020 now, because I started as an independent optical. My average claim amount is $306, and that's from the patient paying, and my conversion rate is 61.2%. My last year's numbers, the average was 302, and my conversion rate, it was from February 2nd to today, was up to 86.18%.
That's great. I mean, you've always really had tremendous pull through on the insurance side. So yeah, really appreciate you sharing your personal numbers with everyone. I think it helps everyone. It's nice to have benchmarks, right? Like how are you doing individually? So I think when you share a benchmark like that, it shows people what's possible, and what good looks like. So I know that you've been really successful with the business. And so hopefully, it's been mutually beneficial, so that's why we love having Stacy on these calls. I will say just so everyone knows, we're going to actually have a number of these expert sessions where I'm going to have a number of different optical retailers who have kind of success in different markets. Stacy operates in Florida, and that's one market where she can do things a certain way. And I have some clients in some other markets where they're able to hire doctors and they bill, and they've had some tremendous success. And I have some other optical retailers in self-pay only situations who've been very successful. So I'm going to be bringing them on a monthly basis and doing exactly the same thing here, where you can ask questions and just hear a different perspective. And I'm just kind of calling it the expert sessions that we're going to have a few of these. And so look forward to having everyone join us again in the future too. But I know there was a last question here from Laura Long about how do we cut down wait time for techs, and doctors to decrease exam times? It's a great question. I'm going to turn it over to Dr. Chang to ask, to kind of for some tips. Number one, we can definitely do more remote training with any on-site staff if there was turnover. Sometimes when like we train the trainer and then there's turnover on site, perhaps secondhand training doesn't go as well. So we also have remote training that we can do to assist if you have new staff members that are having some challenges. The average pretest time, especially with the newest technology, this new VX65 multitasking platform takes about 5 to 7 minutes to do a pretest. So, with some of the newest technology, you should be able to cut down pretesting time to about 10 minutes. I still say 10 to 15 minutes, I think is fair for an accurate pretesting time. So one of the things that we measure when we look at a site is we look at the pretesting time. The most important thing is in our software, we have a drop-down box when you start pretest. And one of the most important things to do that a lot of offices don't do is they don't select that pretesting time when they actually start pretest. Waiting to click that box until the pretest is over is essentially like going to the butcher shop and picking the number after you've already been waiting for 15 minutes. Like, you don't want to do that. You want to pick that you're in the queue before you have to actually wait. And so that's like one of the most important things to do. Again, training, if the pretest time's taking too long, we can measure that. We can see if it's being selected accurately. From there, we can directly measure how long it took between the time you selected ready for refraction and the technician picked up the call. If it's within 2 to 3 minutes, that's what our national average is. Contractually, we say less than 10 minutes, but on average nationally, it's 2 to 3 minutes. And so we can do the same exact thing for the doctor once the technician selects ready for the doctor, we can see exactly how long that timestamp takes. And so we can measure each timestamp along the way. Dr. Cheng, I don't know if you have any other tips or techniques maybe that would help them cut down on wait times. Anything else you see?
Yeah, one other thing I would point out is that, anytime a retest is needed, that's really lengthening the duration of the exam. So as Bob alluded to, making sure that we're doing trainings when necessary. If there's something that people are getting stuck on, that can be really helpful. But if like the fundus photo, for example, is not good quality and the doctor needs a retake so that they can ensure that they're able to assess it, then that process is going to add to the exam time. So that is definitely one area that can decrease waits or total exam time. And then the other thing I'd say is that, our team, myself, our team members who oversee kind of the workflow processes, we're constantly looking at and reviewing this information. It's very important to us from a patient satisfaction perspective and just in providing, good services to all of you guys as our clients and ensuring that we keep those wait times as low as possible. So we track this very closely. As Bob said, we all live in those numbers and that data and really do try and keep a close eye on that.
Stacy, I think the last time I saw your pre-testing time, you're probably between 15 and 20 minutes. I mean, obviously you have a luxury boutique and it's probably a much more luxury setting, but can you share a little bit about your experience? Like, when are you clicking that? Are you clicking the button early before you even start the pre-testing? Is that an accurate representation for you in terms of your total pre-testing time?
So that's a great question. So when I first started out, I was totally by myself. I am an appointment-based office. I will take walk-ins when I can, but I am an appointment-based office. I do have someone that I've been training. And as you mentioned, when you're not the original person and you're training that, it does put it back a little bit longer in the time. The other thing that I have found, and this is just from trial and error because I'm trying to give more time on my schedule to add maybe one more exam a day, is I switched up how I do my pre-testing so my patient is in the dark longer, as Dr. Chang mentioned, to be able to provide better photos, the best that we can for the doctors. So we allow our autorefractor and tonometer first, so they're in the dark, and then I do my photos. Then if I review the photos and I feel like they're too shadowed or I want the doctor to, want to have better photos, we'll continue with the exam and I'll let the patient know I'm going to submit your photos for review. We may need the doctor to, the doctor may want to see a few more. And then it keeps them in the dark longer. So I've adjusted those things to work on that time because I also look at that time very often to try and, maximize my day as well because even if I can add in one more exam. So yeah, it usually runs anywhere between 10 minutes. It's running a little bit longer because I am training someone.
Got it. Yeah, thanks so much for sharing that experience. Um, and again, we're willing to work with everyone. We have trainers on our team who obviously show up on site for 5 days. And then in addition to that, we have remote trainers who can help augment that. So we're willing to help any location that is having an issue. And then certainly we can kind of address the problem. And then if needed, you could also always pay for additional on-site training if we think, again, some offices have staff turnover. And when that happens, obviously we have to retrain the staff members sometimes. And we will do that. I skipped over Mike's question. Apologies, Mike. I didn't mean to skip over your question. But how do established patients react to doctors they've never met? And I don't know if Stacy, you want to share your experience in your office, and good and bad. I know some patients, I believe it's about less than 1% on our NPS surveys. Less than 1% even make a negative comment, right, on our NPS surveys. Stacy, I don't know if you're running the NPS surveys for your practice, but for our managed locations around the country, we run patient surveys on every patient, and less than 1% even making that negative comment that the doctor was not present. So something about the doctor, less than 1% of the time is even commented in a negative way. Obviously, there's a very nice percentage that comment very positively about the doctor experience. But Stacy, I'm happy to hear, if you have a different experience with your particular patients.
I think it's about all in preparation of what they're going to expect during the visit. I stay in the exam lane even when the technician and the doctor are working with the patient. I walk them through and let them know that I show them where the speaker is, let them know where they're going to see the doctor on the screen. It's going to be directly interactive with them at that time. My patient response is great. I get many compliments. Wow, this is the most thorough eye exam I've ever had. So the doctors are great. I'm also very familiar with the doctor staff and the technician staff because I'm going on my third year. So the great thing is that they see my face familiar, I see them, so the patient knows that me and that person already have a rapport.
Dr. Cheng, anything to add on your side? Do you ever have any interactions with patients who are surprised to see remotely?
Yeah, I'd say, the most common comment that I normally hear is, wow, this has been really interesting. I actually really enjoyed this. I think they often come in with, or once they are going through the exam process, sometimes they'll have a little bit of apprehension. But like Stacey said, it's so thorough, and our team members are fantastic. They do such a great job. We really try and communicate that warmth and excitement to see patients even through the screen. That they do end up really usually enjoying the exam. The other thing that I would add in is I like to think of it, I used the analogy earlier with someone I was having a meeting with, and it's like cell phones. At first when cell phones came out, everyone was like, oh no, cell phones. And then it becomes ubiquitous and part of life. And then everyone is wanting to use their cell phones. And I think telehealth and technology is progressing in a really similar manner, in that now patients are often even seeking it out and really excited about the opportunity and the quality of care that it's able to provide.
Yeah, our CEO actually established a telehealth practice for radiology in the 80s and 90s, and provided telehealth radiology services to hospital systems around the country. And so what's really interesting to know is that a lot of people are worried their senior patients or their older patients are not going to be comfortable with teleoptometry, when in actuality, a lot of your seniors and older patients have been getting telehealth services in a hospital-based system for decades, and are actually comfortable with a doctor coming on a screen, whether it's cardiology or radiology. And so that was something I was totally unaware of because I never had that experience. So I think that's something to consider there. And then the younger patients, I think I changed our marketing. I'll just share this with everyone. A few years ago, when my daughter, who was around 6 or 7 at the time, was asking what I do, because I was on the phone talking about this all the time. And I showed her what we do, and she said, so you do eye exams? And that basically changed our entire marketing, because up until that time, we were trying to explain to everybody what we do. There's a patient in a room, in a doctor's room. At the end of the day, patients who are younger have grown up in a very digital world where this is a live meeting to them. This is a live meeting. They have new acronyms now for in real life versus like live. So hopefully that kind of alleviates any concerns around how patients react to it at this time. And I think there was one last final question. Again, I'm happy to answer questions. Dr. Cheng, I don't know if you have to go, or Stacy, if you have to go, you can feel free to drop if needed. But I'm happy to keep answering questions if people have. You're on duty, right? So
No,
yeah,
I wanted to add one more thing if
oh,
possible,
sure.
Bob.
Oh, go ahead.
One thing that I found really honestly inspiring, my background is in public health, and so there's so many patients that have been unable to see an optometrist or an eye doctor in many of the locations that we work with because there is a shortage of optometrists in many locations, especially rural areas throughout the US. So, I mean, I have so many patients where I'll talk with them and they'll be like, it's been 6 years since I've been able to get an eye exam. And I'm just so grateful for this opportunity to talk with an eye doctor, or we catch certain medical issues like diabetic retinopathy that if they didn't have a provider, they would be unable to see and experience and gain that insight that then impacts, their life, because in a sense, we've been able to catch something from a visual perspective that may have gone downhill and even caused long-term vision loss. So it really is an incredible space to work in. And I think overall, I've been surprised in a positive way by how supportive and excited patients are by the experience.
That's really great. One of the things I was really most excited about was when we dropped the patient age to 8 years of age, because I actually, very early on in my career, I sold a test for amblyopia. And so amblyopia is something that, I have a particular passion around. When my daughter was 2 years old, I noticed that she was exhibiting signs that she was like having an issue with one of her eyes. And I brought her to a local optometrist and they said everything was fine. And when she was 5, I was pretty much convinced she was having a binocular vision disorder because I would play sports with her and things like that. And I felt like something was wrong. And I was told she was fine. And then at 7 years of age, I took her to my favorite neuro OD who said she's not fine. And at that point in time, simple patching and some home therapy solved the problem. So I think what we were experiencing, we were seeing like a lot of children at age 10, 11, 12 who were coming in and we were their first eye exam. And so I think the fact that we dropped that to 8 years of age is even better. But we certainly want children to be seen even sooner than that from on-site doctors at their respective locations. But I think it's something that you can certainly feel very proud about being able to offer that service. There was a couple more questions I wanted to get to. Michael asked a question about what happens if you leave the 2020 Now platform? Is there required time to remain in the system? So it's a great question. We don't have a long-term service contract. We have the $2,000 monthly minimum. We have a 60-day out clause for any reason. So we prefer to win your business on a monthly basis. Several years ago, we did not have a monthly minimum, but it's something that we implemented a few years ago. And that was due to the fact that having accounts that maybe like doctor-owned groups that would only use it if they went on vacation for a couple weeks a month, it just wasn't worth it from an IT support standing. So we basically implemented a minimum for accounts where at the end of the day, if a location isn't going to do at least, one exam a day, it doesn't really make a whole lot of sense for you to invest the money on the equipment side anyway. So I feel pretty fair about our monthly minimum and the fact that we have a 60-day out clause on it for any reason. We do have to staff up to be able to provide services. So that's why we have the 60-day out clause, is that if a location chooses to drop off, which very rarely happens, if it perhaps sometimes people get, the most common reason would be someone finds an on-site doctor finally after a year or two, and then they may choose to turn off the monthly service minimum. And we're happy to do that. And if things change in the future, they can reactivate with us in the future. So that is the only limitation, is the 60-day out clause going forward for any locations that are under a telehealth contract. In the sublease states, there is no minimum. So you would essentially just not even use the service. And we would call you and say what's going on. And we would basically deactivate it for you. Because in those states, we can't charge a minimum because we're charging the patient directly. So again, it kind of varies by state, but we're not looking to hold anyone hostage with long-term service contracts. Something mentioned before that wasn't brought up regarding wait times during the exam is that it's an opportunity to get started on the eyewear sale. It's a great point, Heidi. I would defer to Stacy on that. Stacy, do you do something similar to that when you're waiting for someone?
Yes, that's exactly what I do. The way my setup is, you can see the optical behind me, my exam lane is right over here. And we, again, it's very often that we're in here with the patient by themselves. So we'll open the door and I have the volume up that when the doctor or the technician rings in, we can, set down what we're doing as far as the frame styling or discussing lens options. I'll even go over what they're currently wearing in their glasses, what are their dislikes and likes. So you learn to kind of fill that space if it is a little bit longer than normal.
Yeah, it's great. And in fact, we have some industry partners on the call today from Dorigo. And I don't know if anyone on the call carries Dorigo's line of frames. But they have a number of brands under roof. And so something that we're actually working on with them and a couple other major organizations is some videos. In some of our locations, we actually play videos while the patient's waiting for a doctor or the technician. We can play like a contact lens educational video from some different manufacturers. So depending on who you carry, we have one vendor, one of the big three, who already does that and takes advantage of that at some of our locations. And we have another one of the big three, preparing kind of the materials for us to be able to do that for them as well for our customers that carry their line of equipment. And so, and for Dorigo, I think conversations were already had for customers because some of their sales reps referred some of the customers to us, and so to be able to play videos for their patients. So that's something that we're able to do with our platform. If you're able to get the video footage, we can certainly help you with marketing to your patients in your practice. So yes, a really great question there. Great legal question coming out from Anne in terms of what happens to an office if states try to outlaw telehealth to someone that's already started? Are they grandfathered? The short answer would be no. The longer answer is, and that's one of the benefits of doing business with an ophthalmology PC. Generally speaking, and I'm paraphrasing, most of the restrictive rules read, optometry can't do these things, but physicians can, physicians being an MD designation. And so that's essentially how we're able to operate in some states that cannot. So if a state were to come up with very restrictive language that applied to also physicians, then there really isn't anything that you can do about that. So I don't want to overpromise. We don't know what the future holds. I will say the genie's out of the bag in terms of what we're doing here from a service standpoint. There is a huge backlog. Dr. Cheng mentioned this. There's a huge backlog in ophthalmology. So a lot of optometrists have migrated to more medical-based, practices. That's leaving an even bigger backlog for routine comprehensive eye exams to where now doctor groups are bringing us in. We have some doctor groups and hospital system groups that are bringing us in to provide services now who are backlogged 7,000, 10,000 exams a year because they lost a couple providers. They can't find another provider. Their patients have a year backlog to get exams. And so when organizations like hospital systems start lobbying on behalf of patients, I think that's the direction it's heading in, where they're trying to get the laws less restrictive. And so I think the direction that we're headed is I don't see it becoming more restrictive. I see it becoming very much less restrictive, especially in the past year with what's happening with some of these healthcare organizations bringing in our services now. It's not just optical retailers. And no matter how bad it is for optical retail, we were told specifically by a healthcare organization, it's 100 times worse for the hospital systems. And those patients are going to need to be seen, and that's the direction I think it's going to continue to drive it. So, I mean, I hope that gives you a little bit more comfort about that. But in the meantime, we continue to work towards keeping these regulations in check, and our legal firm addresses things when they come up into like committees for discussion. We pose responses to them. So, Dr. Cheng, I don't know if you're involved on the back end on any of those things where you've responded to and you provide like the medical basis for like opening up those regulations?
Yeah, so both Dr. Amy Stevenson and I, we look over the licensing and compliance from a clinical perspective, and both are starting to become very involved in that. So yeah, we work with our legal team to ensure that we're in compliance from that regard, staying up to date with any changes, legislative changes, because it's definitely, I agree with you, Bob, it's a space that's going to continue growing, but a space where we need synergies to exist. I mean, we need in-person optometrists that we can refer to. We need in-person ophthalmologists. This is not a space that is going to take away patients from these other, existing optometrists and ophthalmologists. It's only going to contribute.
Yeah, that's great. So we've had a ton of questions here. I know there's one last question, and I think we'll call it a night. And it was, are we attending the Eyewear Art Walk, which is a new show that's going to be started. And we are attending the first one in Los Angeles, and that is the plan. We'll also be at Vision Expo East and Vision Expo West in the Visionics booth, which is if you're going to Vision Expo East, F2235 actually is going to be the booth. We'll have our multiple lane setups and doing live exams at Vision Expo. And we're also going to be at some other, the Professional Opticians Association of Florida. We're going to be at all their meetings this year. And so just a number of optical shows around the country, in addition to kind of the major ones. And Seco will also be in the Visionics booth at Seco to answer some questions if anyone's going there as well. So really appreciate everyone coming out tonight. Thank you to Stacy and Dr. Cheng for taking your time out of your evening to answer customer questions. And feel free to reach out to us via our website. You can send us an email or contact form or demo requests. Go to my calendar. Happy to chat with you and have individual conversations. But and look out for our future expert sessions and join us in the future to ask more questions. Thanks so much and have a great evening.
Thank you, Bob. Thanks for hosting.
Thank you.